Hi, my name is Pamela Coons, Associate Professor of Medicine in the Division of Oncology at Yale School of Medicine and Yale Cancer Center. I'm excited to announce ASCO's new open access journal, JCO Oncology Advances. As the inaugural editor-in-chief, I hope to support JCO Oncology Advances to become the premier platform to bridge the gap between accessible scientific research and clinical care. Stay tuned for more information, including new article types, at ascopubs.org/JCO Oncology Advances. We look forward to seeing your submissions in spring of 2024.
This JCO podcast provides observations and commentary on the JCO article, Association between BRAF V600E mutation and recurrence of papillary thyroid cancer, by Mingzhao Zheng and al. My name is Robert Haddad, Disease Center Leader, Head and Neck Oncology Program at the Dana-Farber Cancer Institute in Boston, Massachusetts, USA. Papillary thyroid cancer is the most common type of thyroid cancer. It accounts for close to 90% of all thyroid cancer. There are several variants of papillary thyroid carcinoma. The most common types are the classic and follicular variants. Patients with papillary thyroid carcinoma are treated with surgery and radioactive iodine and have an excellent prognosis. A small number of patients will die from papillary thyroid cancer. Various clinical pathologic features are used to identify those patients at increased risk of recurrence and death. Those are advanced age, lymph node metastases, presence of extrathyroidal disease, and distant metastases. Recently, molecular markers have been investigated to improve risk stratification for patients with thyroid cancer. Of those, BRAF V600E mutation has received the widest attention. BRAF V600E mutation is the most frequent genetic mutation in papillary thyroid carcinoma and is considered by many to identify patients at high risk of recurrence. Unfortunately, most of the data we have on this has come from small series and single institutions where patients have been followed for a short period of time. Zheng and colleagues report here on a large cohort of patients with thyroid cancer looking to investigate the prognostic value of the BRAF V600E mutation for the recurrence of papillary thyroid cancer. This study was conducted at 16 medical centers in 8 countries. It is important to note that these same authors have reported last year on the association between BRAF mutation and mortality in patients with papillary thyroid cancer, showing that the presence of the BRAF mutation was significantly associated with increased cancer-related mortality among patients with papillary thyroid cancer. Overall mortality was 5.3% versus 1.1% in BRAF V600E positive versus mutation negative patients. In this report I am discussing today, these authors report on the association with recurrence, not mortality. The authors studied a total of 2,099 patients, mostly females across 16 centers. These patients were young, with a median age of 45 years. The overall BRAF V600E mutation prevalence was 48.5%, and the overall papillary thyroid carcinoma recurrence was seen in 16.1% of patients. These numbers appear to be consistent with what is previously reported in the literature. The overall median follow-up time for all patients is 3 years. For the primary endpoint of this report, which is the association between BRAF V600E and recurrence of papillary thyroid cancer, the authors found that the recurrence rates were significantly higher for BRAF mutation positive compared to mutation negative patients. For all patients in the study, 20.9% of BRAF mutation positive patients and 11.6% of mutation negative patients had a recurrence. Restricting the analysis to patients with classic and follicular variants, recurrence rates were again significantly higher for BRAF mutation positive compared to mutation negative patients. For classic papillary thyroid cancer, the BRAF V600E prevalence was 56.1%. In this cohort of classic papillary thyroid cancer, 20.7% of BRAF mutation positive and 12.4% of mutation negative patients had a recurrence. For follicular variant papillary thyroid cancer, the BRAF V600E prevalence was 20.6%, and in this cohort, 21.3% of BRAF mutation positive and 7% of mutation negative patients had recurrence. The authors also examined the effect of BRAF V600E and several classical clinical pathological factors as stated above. These factors are known to have a prognostic value in this disease. The authors are able to show here that patients with either a BRAF mutation or lymph node metastases had a higher recurrence probability, and the probability was further increased with coexisting mutation and lymph node metastases. Similarly, the presence of either BRAF mutation or extrathyroidal invasion was significantly associated with an increased recurrence risk, and patients with coexisting mutation and extrathyroidal invasion had even a higher risk of recurrence. For patients age less than 60 years with the mutation or age more than 60 years without the mutation was significantly associated with increased recurrence rate, with the highest recurrence rate seen in patients older than 60 years old who were BRAF V600E positive. In summary, this is the largest report in the literature to show an independent prognostic value of BRAF V600E mutation for papillary thyroid cancer recurrence. The authors were able to show conclusively and in a large cohort of patients that having a BRAF V600E mutation increases the risk of recurrence and have previously shown an increased mortality in the same group of patients. This is important and relevant information to have as we take care of patients with thyroid cancer. BRAF inhibitors are now available for patients with BRAF mutations such as melanoma and lung cancer. A recent report on patients with thyroid cancer and BRAF V600E mutation showed promising results with a BRAF inhibitor, vemurafenib. Going forward, it will be essential to expand on these results and move toward precision-based treatment for these patients, targeting specifically this mutation like we currently do when treating patients with an EGFR or KRAS mutation, for example. As more therapeutic options are available for patients with thyroid cancer, it will be of the utmost importance to identify those patients at the highest risk of recurrence and death and possibly treat those patients early on while pursuing an observation strategy for those patients who have indolent disease and are unlikely to die of thyroid cancer. This concludes this JCO podcast. Thank you for listening.
For more original research, editorials, and review articles, please visit us online at jco.org. This production is copyrighted to the American Society of Clinical Oncology. Thank you for listening.